enough about that. But usually, usually you would just go in core practice. You can bring up your photos, x-rays, talk to the patient, explain the treatment plan. Then we've got the toothbrush model if you want to teach them toothbrushing technique. I usually just leave some floss here so I can show them how to floss as well. There's some pictures here, but we only have 2 and they're really big, but you can just explain to the patient. So those ones, I think we get most of them away already. I probably need to get some more. I've just got like some elastics if you need to explain elastics. Another pixel brush. And then there's like chewies if you want to explain to them chewies for the clear aligners. This clear aligner model. This one has the attachments on it if you want to show them what attachments are. And for a while I was using this one, but these are my son's teeth, but I think the patients think it's weird when I show this one because they can tell it's from a real person and they're like, oh, is that clean? I'm like, yes, I sterilized it, but it's still not new. Then this is occlusal splint if you want to show the patient what the splint is. Implant model, lip and crown model, and bridge model. So you can unscrew that if you want to explain what a bridge is, and then you can fit the bridge one. Examples of crowns if I'm trying to explain what a crown is or a onlay. We have this little booklet that has just like different conditions like perio, what's that, abscess, caries, white spot lesion, erosion. I don't really use all of them. I normally just, if I want to explain to the patient about how your tooth has got like a pulp and a dentine and an enamel, it's pretty good for that. Okay, this is the light for the whitening. So I will show you how to use it because the first time I used it I was really confused. Obviously take it to whichever room you're using it in, and you want to plug it in. Make sure the power point is turned on. Even if your dental assistant plugs it in, sometimes they don't turn the power point on, so just make sure of that. And then this switch has to be on, and then here I'm pretty sure you just press and hold start. Yep, that's to turn it, like wake it up or something. If you don't press and hold and you just short press it, it does nothing. And then if you want to change the time, you can up and down the time. And then to turn the light on again, you just push start. And then if you want to stop it, you just push stop. I guess like if you're like halfway through and you just want to pause it, you can pause and play as well. If it's paused, it's flashing like this. Oh, this will also beep 1 minute before, so this number 20, that means 20 minutes, and then it'll count down from 20. So I usually do 3 sessions of 20 minutes. It counts down from 20. When it gets down to 1 minute, it'll beep. I think it beeps once when it gets to 1 minute, and then when it's 0, it beeps 4 times, I think. But just if you hear it beep, then it's probably gonna stop soon. Okay. Okay, Sarek. Let me just turn this off. Okay, this is the milling machine for the CEREC, and this is the CEREC scanner. I think it's on right now actually. Wait, don't show it in case there's somebody's pictures. So this is the CEREC scanner. That is the scanner, and we don't have sleeves for it. We wipe it down after each use and then wipe it with gauze after. This is the heater for it. So if you're just holding it like this for a long time, then the scanner will cool down and it will not scan properly. So whenever you're not having it in the patient's mouth, just put it back here. Otherwise, it's going to lag. And then just push that to close it, lock it in. Okay, 1 or 2 times. This kind of unplugged. I might just should I show how to unplug it? Yeah. I think you just pull. Yep. And then you see how there's little things around the edges, and then this one just has one little rectangle there, kind of like the slow speed handpiece when you're plugging that in. And then this one has 3 big rectangles, but there's only one small rectangle. So that small rectangle has to line up with the other small rectangle. If you just plug it in any which way, A, it won't scan, and B, I will be very upset with you because we won't be able to unplug it again. And it just clicks in. Okay. Okay, so the mouse is a bit weird. You have to roll to move the mouse, and then there's 3 buttons here. Connect is if you just want to send something to the lab. So I usually use that if I'm doing clear aligners or occlusal splint or something like that. And then the CEREC SW is if you're gonna do a crown and mill it here. If you scan in Connect and then you decide, oh, actually I want to mill it myself, bad luck, you can't. You have to start again in CEREC. Okay. So I will just open a file. I wonder if I should have opened one inside. Oh, actually I have one inside already open. Alright, so if you want to rotate like that 3D, you're gonna press the first button on the left and then move the ball with your fingers. Okay, and then the middle button, if you press and hold the middle button and roll the ball, it's just zoom in, zoom out. And then the button on the right and roll the ball, it's like move up, down, left, right, whatever. Okay. If you don't know how to use CEREC, you should go to the course or ask me to teach you one-on-one, because I think it's going to be too long to explain the whole process on a video. Okay, and then when you mill, always choose size 14 block. So normally I don't use Smart, but I used some yesterday, that's why it's coming up. But it's the blocks are over here, so you can see CEREC blocks. We only have size 14 for any of them. So this block is called Initial Lissy. I mean, the names of the blocks are written on them anyway, so it's pretty self-explanatory which one you're going to choose. And then the Emax blocks, so also size 14. Oh yeah, here is all the glazing stuff, and there's some more glazing stuff here. So it's fine to use these colors with Emax as well. Those both are just white. I think we have 3 different whites. I'm not sure what the difference is between the 3 whites, but if someone finds out, you can let me know. And then this liquid, the crystal glazing mixed with the stains. Here we have the object fix, which you put inside the crown when you're furnacing it so that it doesn't shrink. We have some brushes, we have little mixing wells, diamond polish. I think it's goat hair or something. That's meant to be to use with the diamond polish. Okay, when you want to polish your Emacs, I usually use just high speed and slow speed handpiece. I don't have a lot of straight handpiece burrs. I will show you which burrs I usually use. Or should I show you this first while we're in this room? So this is the plug. This is where you I usually unplug it because if it's plugged in and turned off, it makes such a loud noise. So I just don't know if I'm using it. Yeah. Here's the screwdriver. If you ever need to change burrs, they are here. There's a spare one of those. And then if you need to change the filter, I'm pretty sure this is the filter. Yeah, that's the spare filter for the water, but I did it recently, so I don't think it's going to happen anytime soon. And that's the liquid for the water. Okay, so just like press to open, and then you can just unscrew it there. And then if you want to put it in, okay, so you know how normally there's like a little notch to tell you where it is? I think ours is broken off, but you can see where it used to be. So that's where you have to line up the little groove, and then just make sure that it's flush. You'll probably notice anyway if you're using this. And then you can just screw it back. This is quite loud, so when I'm using it, I normally close the lid. Okay, I'll show you the burrs there in the stereo.